Depression. Depression is a mood disorder characterized by persistent feelings of sadness, hopelessness, and a loss of interest or pleasure in activities once enjoyed. It can affect how a person thinks, feels, and handles daily activities, often leading to significant impairment in functioning. Symptoms may include changes in appetite or weight, sleep disturbances, fatigue, feelings of worthlessness or guilt, difficulty concentrating, and thoughts of death or suicide. Depression can vary in severity from mild to severe and may be triggered by various factors, including genetics, life events, brain chemistry, and medical conditions. Treatment typically involves a combination of psychotherapy, medication, lifestyle changes, and support from loved ones. Anxiety disorders. Anxiety disorders encompass a range of conditions characterized by excessive worry, fear, or nervousness that can be debilitating and interfere with daily life. Generalized anxiety disorder, GAD, involves persistent and excessive worry about a wide range of activities or events. Panic disorder is marked by sudden and repeated episodes of intense fear, known as panic attacks. Social anxiety disorder involves a fear of social situations and being judged or embarrassed by others. Specific phobias involve intense fear or anxiety about specific objects or situations, such as heights, flying, or spiders. These disorders can cause physical symptoms such as rapid heartbeat, sweating, trembling, and difficulty breathing. Treatment may include therapy, medication, relaxation techniques, and lifestyle changes to manage symptoms and improve quality of life. Bipolar disorder. Bipolar disorder, formerly known as manic depressive illness, is a mood disorder characterized by extreme mood swings that include periods of mania, elevated mood, increased energy, and depression, low mood, loss of interest. These mood fluctuations can severely affect behavior, judgment, and relationships. During manic episodes, individuals may experience racing thoughts, impulsivity, grandiosity, and decreased need for sleep. Depressive episodes may involve sadness, fatigue, difficulty concentrating, and thoughts of death or suicide. Bipolar disorder can disrupt daily functioning and may require lifelong treatment with mood stabilizers, antipsychotics, or other medications, along with psychotherapy and support from mental health professionals and loved ones. Schizophrenia. Schizophrenia is a severe mental disorder characterized by distorted thinking, hallucinations, delusions, and disorganized speech or behavior. Individuals with schizophrenia may experience hallucinations, such as hearing voices or seeing things that aren't there, as well as delusions, which are false beliefs that are not based on reality. Disorganized thinking and speech may make it difficult to communicate or maintain relationships, and individuals may exhibit bizarre behaviors or movements. Schizophrenia typically emerges in late adolescence or early adulthood and can cause significant impairment in social, occupational, and daily functioning. Treatment often involves antipsychotic medications, therapy, and support from mental health professionals and family members to manage symptoms and improve quality of life. Obsessive compulsive disorder, OCD. Obsessive compulsive disorder, OCD, is an anxiety disorder characterized by intrusive, repetitive thoughts, obsessions, and behaviors, compulsions, aimed at reducing anxiety or preventing perceived harm. Common obsessions may include fears of contamination, harm, or causing harm to others, while compulsions often involve repetitive rituals or mental acts performed in response to obsessions. These rituals may provide temporary relief from anxiety, but can become time-consuming and interfere with daily activities. OCD can cause significant distress and impairment in functioning and may co-occur with other mental health conditions such as depression or anxiety disorders. Treatment typically involves cognitive behavioral therapy, CBT, exposure and response prevention, ERP, medication, and support from mental health professionals and loved ones to manage symptoms and improve quality of life. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, can develop after experiencing or witnessing a traumatic event, such as combat, natural disasters, accidents, or interpersonal violence. Symptoms may include intrusive memories, flashbacks, nightmares, hypervigilance, avoidance of reminders of the trauma, negative changes in mood or cognition, and alterations in arousal and reactivity. PTSD can cause significant distress and impairment in daily functioning and may interfere with relationships, work, and social activities. Treatment typically involves psychotherapy, such as cognitive processing therapy, CPT, or eye movement desensitization and reprocessing, EMDR, medication, and support from mental health professionals and loved ones to address symptoms and improve quality of life. Attention deficit/hyperactivity disorder, ADHD. Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder characterized by symptoms of inattention, hyperactivity, and impulsivity that interfere with functioning and development, particularly in children and adolescents. Inattention symptoms may include difficulty sustaining attention, making careless mistakes, being easily distracted, and forgetfulness. Hyperactivity symptoms may involve fidgeting, restlessness, excessive talking, and difficulty staying seated. Impulsivity symptoms may include interrupting others, difficulty waiting turns, and acting without considering consequences. ADHD can cause significant difficulties in academic, social, and occupational settings and may persist into adulthood. Treatment typically involves a combination of medication, behavioral therapy, education, and support from mental health professionals, teachers, and family members to manage symptoms and improve functioning. Eating disorders. Eating disorders are serious mental illnesses characterized by unhealthy behaviors related to food, weight, and body image. Anorexia nervosa involves severe restriction of food intake, fear of gaining weight, and a distorted body image. Individuals with bulimia nervosa engage in episodes of binge eating followed by purging behaviors such as self-induced vomiting or excessive exercise. Binge eating disorder involves recurrent episodes of binge eating without compensatory behaviors. Eating disorders can cause significant physical and psychological consequences, including malnutrition, electrolyte imbalances, digestive problems, and depression or anxiety. Treatment typically involves a multidisciplinary approach, including medical monitoring, nutritional counseling, therapy, such as cognitive behavioral therapy or dialectical behavior therapy, and support from mental health professionals and loved ones to address underlying issues and promote recovery. Borderline personality disorder, BPD. Borderline personality disorder, BPD, is a mental illness characterized by unstable moods, relationships, and self-image, along with impulsive behavior and a fear of abandonment. Individuals with BPD may experience intense emotions and have difficulty regulating them, leading to frequent mood swings and interpersonal conflicts. They may engage in impulsive behaviors such as self-harm, substance abuse, reckless driving, or spending sprees. BPD can cause significant distress and impairment in daily functioning, including difficulties in relationships, work, and self-care. Treatment typically involves dialectical behavior therapy, DBT, medication, and support from mental health professionals and loved ones to manage symptoms, improve coping skills, and promote stability and well-being. Substance use disorders. Substance use disorders involve compulsive drug or alcohol use despite negative consequences, including physical, psychological, social, and legal problems. Common substances of abuse include alcohol, tobacco, opioids, stimulants, cannabis, and hallucinogens. Substance use disorders can cause significant impairment in various areas of life, including work, relationships, health, and overall well-being. They often co-occur with other mental health conditions such as depression.